Hello and welcome to Let's Talk About, a health podcast series brought to you by Tallaght University Hospital in partnership with the Adelaide Health Foundation. This is our second 6-part podcast series, which you can find on the hospital YouTube channel, Facebook page, Apple Podcasts and Podbean. Each episode in the series will be targeted at anyone who wants to learn more about their brain, how they can mind it and how they can keep it healthy. Weighing in at approximately 3 pounds or 1.3 kilograms, the brain is a complex organ that is made up of soft tissue called grey matter and white matter, which contain neurons. Neurons are cells that send and receive information throughout our bodies in the form of electrical and chemical signals. Think of your brain as mission control for how you move, your senses, thought and reasoning, memory and vital functions such as your heart rate and breathing. Like everything else, your brain ages, but as you will learn in this series, there are lots of steps we can all take to help maintain a strong and healthy brain. The most important thing to remember is, it is never too early or too late to look after your brain health. Hello, my name is Paul McElwain. I am a consultant geriatrician at TUH and your podcast host. In this Let's Talk About podcast episode, we're going to talk about the role of our brain health and our senses. I'm joined by Maria Domsa, advanced nurse practitioner in older persons, and Lisa Sheridan, speech and language therapist. Hello.
Hello.
So Maria, can you explain what the brain senses are? And if it's not too obvious a question, why our senses are important to our brain?
The brain is the most complex organ of our body, as we know. This 3-pound organ is the seat of our intelligence and is really the interpreter of our senses and and is initiator of our body movements and also the controller of our behavior. So the senses are the psychological capacity of organism that provides data for perceptions. As we know, as humans, we have 5 senses: sight, smell, touch, taste, and hearing. As we know, we see with our eyes, we smell with our noses, listen with our ears, and taste with our tongue. So sight is really the most important of our senses because we perceive up to 80% of all our impression by means of our sight. So we see all the environment around us. So what's happening? The light entering into our eyes upside down, and then the image goes to the retina. The retina transforms the light into the nerve signals. This goes to the brain, and the brain interprets the images, and then the images it's turned right side up. The second sense is hearing. The sound really goes into our ear as a result of a sound wave, and then this makes our eardrum vibrates. So the sounds travel to middle ear and then goes along until it gets the nerve signals, and this is gone to the brain through the cortex, then process the signals and telling us what really we are hearing. The third sense is the taste, as I mentioned. The tongue contains small groups of sensory cells called taste buds, and this reacts to the chemical in our foods. So for example, when we eat sweet, sour, salty, bitter or savory food, these taste buds send messages to our brain, and then the cortex is processing the information, and that's how we know what we are eating and what type of taste is that. The smell, the olfactory cells based in our nostrils, they react to the chemicals when we are breathing, and then this signal is transmitting along to the nerves in our brain, and that's processed like that. And then the last sense, the touch. The skin contains millions of sensory receptors that gather information related to touch, and then the pressure, temperature, and pain, and then this is also sent to the brain and processed. And I suppose what you asked me there, Paul, was how important is to our brain to maintain our senses and to protect them, and why they are important is because they really help us to understand the environment around us, also really protect us from any disasters like natural hazards or bad food, and help us to communicate between us as humans. Also, as I mentioned, they help us to communicate with the world around us. They have a very important aspect in our communication as human human beings and also to our memories and our emotions, and really have the impact the way we are feeling at the moment. But to say that, to continue the idea, we also can experience like nice experience, for example, enjoying a lovely meal in a restaurant, or listening to a lovely music, or having a nice massage, and relaxing, and we build up our immunity system by doing that.
I suppose we've got a little bit more of an understanding of the importance of smell recently with COVID, which is an odd
Absolutely.
symptom that people have had to experience with loss of smell. So do you have any advice on how we can protect these senses as we age and why it's so important?
Absolutely. So what we need to do, especially for sight, which I mentioned earlier, is there is three things we have to look to, like cataracts, glaucoma, and macular degeneration. And as per Royal National Institute of Blind, when we get older, we are really prone to get cataracts. So I suppose what we can do is to give up smoking, avoid lifelong exposure to sunlight, eat a very healthy diet with plenty of antioxidant and vitamins. So with regards glaucoma, there was a study done in 2021 which showed that a healthy diet and exercise may reduce the risk of the pressure into your eyeball. And then the macular degeneration, some factors what we can prevent is a healthy diet, as I mentioned earlier, introduce in our food omega-3, fish oil, stop smoking, maintain body normal weight, and managing our disease like hypertension or cardiovascular disease.
One of the senses which I guess is often underappreciated and often perhaps a little difficult to talk about is hearing. And I would have observed that people have difficulty around the wearing of hearing aids or admitting they have a hearing problem. I don't know what advice you can give people maybe to overcome that nervousness or anxiety around hearing.
Yeah, so hearing is just so important in our communication. As we know, communication is a two-way process. So the person needs to be able to hear to respond. And it's so closely linked to our communication and our cognition, or our memory and our thinking. And so we know now from the research that if someone has a mild hearing loss in their midlife, they're twice as likely to develop a dementia or a cognitive impairment as they get older if it goes unchecked. And if that's a severe hearing loss, that increases to 5 times the risk as we get older. So I think it's just, if you notice your family member is struggling to hear you, turning up the television really loud, struggling to hear you on the phone, really do encourage them to go and get their hearing checked. Maybe talk to your local GP or your local audiologist, and just knowing that it's so important from our midlife on to make sure we're getting it checked really regularly.
Okay, Anne-Marie, would you echo those sort of thoughts?
Yes, I totally agree with what Lisa said there. The way she mentioned hearing is so important. So imagine ourselves if we are not able, for example, to hear a fire alarm, for example, and we are in a danger, how important it is to get out of that situation. So yeah, just to avoid the exposed to very loud noises, as I mentioned before, to check hearing regularly, to go to have the audiology, test done, and also to actually a very good point there. Many of us we just use the cotton bud, to clean our ears. So that's really a damage to our ears. So don't do that.
Okay.
So I
just
know
be careful what you put in
be
there.
careful. Yeah, exactly.
That's always a good advice in general.
Yeah.
And that's I think the overall point is, if you observe a problem, it may be something minor that you don't hear the television as well, but as Maria said, it can actually get worse, and then next thing you can't hear something as serious as an alarm. And that goes the same for your vision. If you're noticing some vision impairment, perhaps you can't read a sign as clearly, but then that could escalate to actually being a falls risk where you don't observe hazard. So just very good points from you both there. Lisa, you're a speech and language therapist.
Yes.
Can you tell us how our speech and how we communicate can relate to our brain health?
I suppose our communication is just so important and so integral to our daily life, to every part of everyone's life, really. And as Maria has spoken about, the brain controls almost everything we do. And so it has a huge role in our communication. It controls how we speak, how we understand, how we process information. And I suppose we now know that there's this kind of cyclical relationship, that your social contacts and your social connectedness have this protective factor for your brain. So we know that social contact and maintaining your relationships as we get older in life has this protective factor over our brain to really reduce our risk of developing dementia in our later life. So it's so important that we continue as we get older to maintain those relationships, getting out and about, going to your groups, whatever it is, but just making sure that we're talking and communicating. And so, as I've kind of said, it has this cyclical cycle where the more we talk, the more we kind of protect our brain health, and our brain continues to be strong and continues to make sure that our communication is really strong to help us as we get older.
So if I was a family member, or if I was someone listening at home and I had some concerns around my speech, is there certain things they'd look out for that may be telltale signs?
Yeah. Things we can look out for. There are certain things that in our speech that are part of typical aging, and things that we can watch out for. And I'll go through them now. But there are also, if these are getting a bit more progressive, or if they're happening a bit more often, that's when you should talk to your GP, or maybe talk to a professional nearby, or to your local service. But things we do look out for as we get older, I suppose our communication is affected by, we mightn't be able to focus the way we would have before, or maintain attention on certain conversations the way we always did. And we might forget people's names, forget objects, things that we don't use very often. So it might be that you forget the most recent grandchild's name, or you might forget the name of an object you don't really use very often. You also might, have difficulty maybe keeping up in a conversation if there's more than one person talking, or if you're kind of trying to compete with noise or a crowd. And so, as I said, those things should be happening quite minimal. They shouldn't really interfere too much with your daily life. But those are the things we look out for. So kind of difficulty remembering names, remembering objects, and maybe having difficulty following a conversation or keeping up in a conversation. So if they're happening a bit more often, getting worse over time, maybe that's when you need to look out for your loved one and maybe contact your GP about it.
Yeah, and there's almost a similar concept of exercise, that
Exactly.
if you're not using your language or your speech, it often can struggle if you're put in that challenging situation all of a sudden. It can look like you've a problem, but it's really you're just out of practice.
Exactly, yeah.
So is there any specific tips, and I'll ask both you, Maria and Lise, that you look for around brain health and protecting our senses? I know you've mentioned some, but some that you really would want to let people know about.
The takeaway message from me will be: follow a healthy lifestyle, avoid smoking, taking regular exercise, and eat a healthy diet. Ensure a healthy environment, like wearing sunglasses, please avoid to be exposed to very loud noises, in terms of your hearing, because that's very important to protect that. Ensure a good dental hygiene. Take care about your skin. Avoid any injuries, any burns, any bruising. And then what my advice will be, if you see any change in any of your senses and you are worried about, get advice from a medical practitioner and get in touch and get that checked.
Yeah. I might even, just before you bring up your top tips, the idea around dentition, I thought that's actually an important point, because it's, I think, really underappreciated in the hospital, maybe because we don't have necessarily dentists working on site, but the difficulties around pain with teeth, or, articulation, if you've got difficulties with your dentition. I don't know if you encounter that a lot.
Yeah, we really do. And another side of my job is looking at eating, drinking and swallowing. So our dentition is just so important for our speech and our eating, drinking and swallowing. And we do see, there's large studies being done in the country at the minute on looking at dentition and how it impacts the older person. And it has a huge impact on speech, and it can really lead to those feelings of isolation or withdrawing. It's such a part of who we are, our teeth and our smile. And so, it's really important to be, linking in with your local dentist, or, encouraging your loved one maybe to go and get it checked quite often.
Yeah. And then just to give you the opportunity, if you had a top tip from a speech and language point of view, and I mean, as you've mentioned, it kind of encompasses a lot of the senses in order to be able to communicate. What tip would you give people listening?
We can exercise our brain the same way we can exercise our body to keep it fit and agile. So what we would always advise people to do is, there's 3 kind of top areas, as Maria has already discussed: physical activity, social engagement, and kind of brain stimulation. So we would really advise the top thing to do is keep in contact. Keep your social relationships up. Make sure you're maintaining those relationships and getting out and about and talking. That's the main thing. And one other thing I'd advise is just to keep up things that maybe you enjoy, like crosswords or Sudoku, or if it's reading your book, listening to the radio, whatever it is. So keeping up those kind of activities that are almost like brain training, and we would advise most people to do that.
Okay. Well, a big thank you to our contributors, Maria and Lisa, today. I think some of the key take-home messages, and it's thematic through the series, the importance of exercise, how it's beneficial in all elements of our life, I think the importance of the senses really are how we enjoy life. You know, if we have restrictions in those, that can impact that. So just to be aware of them. If you have a difficulty with one of them, don't ignore it and seek some help. So a big thank you again. Thank you for listening. In the next episode, we will look at brain health and living well with dementia.